Okay, great. Anna, how you doing today?
Great, thank you.
So let's just go back. We did an INSPAN on you, and you had a little slip at L4-5, and you were getting some pain down your leg. So tell me what your life was like, a couple months ago.
So I had a lot of progressive pain that got worse as the day went on. It was pain that was shooting down my left leg to my left thigh, and I had numbness in my left foot.
And then it was getting worse and worse and worse, and
Progressive.
once it started, it wouldn't stop. And originally you could, walk quite a ways. In the morning you could walk, but then as the day went on, once that started afternoon, then it just got intolerable, and it was really affecting your lifestyle.
Very much so.
And so we got your MRI, and it showed that L4 had about a 4mm slip there, and inside the canal there was pressure on your L5 nerve root because it was slipping. The nerve where the nerve was exiting was narrowed, and that was just getting worse and worse. So what we did, we put a spacer in there, an INSPAN spacer, and the spacer created some room at L4-5. We were able to elevate here, and we put a spacer in there which locks in. And what that did is opened up around where the nerve roots exit here, and took pressure off the exiting nerve roots and took pressure off the nerve that was causing pain. And then that locks in place. And so we did that surgery 2 weeks ago. How was the pain afterwards?
Very minimal, only mostly located at the incision site.
Yeah.
Yeah.
And you really didn't you took like 3 or 4 pain pills, right? Which is highly unusual. I mean, most people have pain for a week or more and need more pain pills, but in your case you did extraordinarily well in it, and so you didn't need much pain pills, and you've been able to resume.
I'm back to work.
Walking,
I'm walking a couple miles a
sitting,
day
and standing as much as you want. So you had a really smooth post-operative experience, and you resumed everything. So
yes,
so
I'm very grateful. This was the best thing I could have done.
You had a remarkable recovery, and identified her. What we were able to do is, I was able to identify her problem, which was developing. We identified it fairly early and fairly quickly on, and now we've created a room and stabilized, and that slip, it won't slip anymore, and we've taken pressure off the nerve roots. So you've really done extraordinarily well, but we've been able to catch this problem early before it progressed. So great. So I'm so glad you allowed us to do this, and I think it was the right procedure for your condition, and I think we've stopped the progression. So great.
Thank you so much. I feel like I can resume my normal activities of daily living. I can walk. I can do everything. So I feel great.
Happy for you. Thank you.